moving into industry trends, buzzwords, everything like that. I know everybody talked about value-based care. It depends on how you define it. I don't know what that means, but how is, as we look today in, what is this, April 2024, how's value-based care performing?
Value-based care is a scam, at least from my standpoint. It was an interesting idea. It's a great in theory. Most health systems don't have the culture to do it. You're either fee for service or you're risk, but when you try to blend the two, it doesn't seem to work particularly well. So, most people, when they think of value-based care, think of Medicare Advantage. And if you turn to the next slide, Medicare Advantage is under a lot of regulatory pressure right now and scrutiny. When you look at how these companies make their profits, the first thing is most of the for-profit Medicare Advantage plans have an affiliated PBM or pharmacy benefit manager. And these folks are jacking up the retail prices so the co-payments and deductibles for patients are higher. This is from a New Mexico study that said as much as 23% of prescriptions had co-pays that exceeded the cost of the drug to the PBM. The second thing is risk scores. They're aggressively inflating risk scores. Prior authorization is a disaster. It's not only hijacked the physician's ability to practice medicine, but it causes delays and denials and a huge cost to physicians and hospitals to deal with those denials. We see aggressive, unregulated, misleading marketing, which is now being addressed through regulation. The patient's premiums are low, but if they get sick, it's going to cost them a lot of money.
Right.
And they can't go to for example, if you have cancer and an NCI designated cancer institute is in your market and they're not participating in that Medicare Advantage plan, you can't go. You're out of luck. We see most significant to me is the below market payments to providers. They say they're paying Medicare rates, but after denials and delays and downcoding, it's a lot less. This is resulting in, thank goodness, providers waking up and not participating in Medicare Advantage, which creates an inadequate market for these Medicare Advantage plans, and eventually that will catch up to them. Last point is, if this is value, meaning your cost per outcome is better, then why is it that we're seeing different independent organizations say that it's costing 14 to 20% more per patient to be in Medicare Advantage than it does in Medicare fee-for-service?